Hey guys, what's going on? Welcome to today's pandemic update video for Tuesday, April 4th, 2023. Hopefully everyone's staying well. Hopefully everyone's staying healthy if you can. And we do have a lot of stuff to report on today. Alok Pandey, who is the Physics Wallah founder, revealed on Monday, April 3rd, that he has been suffering from COVID. He first tested positive back on March 16th. Currently, he is 32 years old. I've added a couple sources here for this, and within those sources, it's saying he's waiting test results of another test. So apparently, he's been positive since March 16th. And yes, this is in India, so yet another celebrity case in India. Speaking of India, let's look at India's numbers. India logs 3,038. New COVID infections, active cases rise to 21,176. So it's another 3,000 today. It's not a massive increase over yesterday. So that's some good news. But nonetheless, their number of active cases continue to rise. All right, then there was this that I found today. A PA senator urges continued coverage of at-home COVID tests. So they want it to continue to be affordable or free. And I do think that needs to happen. U.S. Senator Bob Casey is urging the Department of Health and Human Services to continue covering at-home tests. Yes, we continue to need free at-home tests, but as I always say, we continue to need PCR testing to be kept free as well, because remember, at-home tests do not get reported. Yes, there's a way you can report them in the HHS, but about 99% of the people don't know how to do that. To be frank, I don't even know if I still have the link to get to that. So it's so hidden, it's unbelievable. And they're probably going to end that soon. But we really do need PCR testing to continue as well, because that gets reported to the state. But as we know, most people do not opt to do that anymore. And then I saw this today as well. And this is actually some good news. Maine Health awarded more than $800,000 to study cause of long COVID. So that's good. We're seeing money get invested into long COVID causes, and if that continues, maybe we can actually start getting some answers about it, because we are 3 years into this, and we do not know anywhere near enough about long COVID as to why do some people get it more? Why do some people not get it at all? I mean, there's a lot that needs to be understood about this, especially the various different symptoms, why some get it, why some don't. And then there was this, COVID-19 public health emergency ending, what will change? And we went over this yesterday, and we'll continue to go over this from time to time. And the biggest thing that we know is going to change, the cost of testing and the cost of getting a vaccination. And also, if you're hospitalized, this may drop some people from actually being covered from the COVID hospitalization, which that's not a good thing, because many people can't afford to be hospitalized. I always look at it this way. The people that go off and think, oh, everything's fine and dandy, all's fine and dandy, I always think, really? If you were hospitalized by COVID, would it be fine and dandy for you to pay for that hospitalization? I don't think so. So no, everything's not fine and dandy, because if you get COVID, it could be a big financial burden on you. Then there was this today, and alright, you're taking a look here at a CAD. This was Chester County, Pennsylvania. I get these people that tell me, well, what was it like before COVID? It wasn't as bad as this, and this actually continued. This is a screenshot I took earlier. It actually continued further down below. Some people say, oh, it was always this bad, you didn't notice it. No, it wasn't. At the time that I took this screenshot, Chester County was up to 23 active calls. I've been following these things since 2010, 2011. You know, that's long before coronavirus. They had an uptick during the swine flu era, as hospitals here were overwhelmed for that. But that passed, and now you're left with this: respiratory difficulty, heart problems, sick person, respiratory difficulty. I mean, you do have some of the regular stuff mixed in, but heart problems, another heart problems, another sick person. I mean, the list goes on. It's just the fact that it's just this much frequency during the afternoon hours. It just gets insanity. From about 12 to 7 o'clock each day as of the last 2 weeks have just been totally insane with call volume in various counties in this area, indicating, one, post-COVID symptoms are bad. Two, we're probably under the start of another wave. I don't care that the state's hospitalizations are not reflecting that. It's apparent to me there is definitely a wave going on right now. I mean, I hate to even say this. We have a neighbor around here that's being released today for COVID. Only was admitted yesterday, but they're releasing him because, guess what? There's no more beds available. So yeah, these numbers that say, oh, they're dropping, I'm not buying that whatsoever. The stays are shorter simply because they don't have the bed capacity. All right, moving on to this. Today in COVID history. CDC launches a new weekly SARS-CoV-2 virus surveillance report called CoView, summarizing weekly data on COVID-19 hospitalizations, deaths, and testing. This was April 4th of 2020. More than 1 million cases of COVID-19 had been confirmed worldwide, a more than 10-fold increase in less than a month. So, yeah, this was a really bad time period back in April of 2020. Now let's go to some more bad news. There's been somewhat of an update to the COVID wastewater map today. And the first thing that's going to strike your eye here, starting to blend more in with the color of the map, indicating less sites are reporting. All these gray sites not reporting. There's a whole bunch of them in New York. I mean, we've seen before where earlier in the week some sites aren't reporting, then they come back later in the week. I hope that's the case here. I really hope we don't lose wastewater. It's such a valuable metric. I was recently telling some people about wastewater tracking, and they were like, really? You can detect COVID in the wastewater? They were just blown away that that was possible. I'm like, yeah, we can actually see how safe it is in the community. But that only happens when wastewater is being reported. And look at New York State. Other than New York City, a large majority of the sites in New York State are not reporting. Missouri is a similar issue. California, it's a similar issue. A lot of the Northeast states. I mean, it's becoming an issue in many areas. Michigan, look how many gray sites are popping up here. So I am deeply concerned we may lose wastewater soon. I mean, there'll still be some counties reporting, but it's getting concerning. All right, the transmission map, which is, as you know, this is from last Friday, but continues to be concerning because we're starting to see high transmission rise again. 994 counties are in high transmission. That's up by over 1%. Substantial is down slightly to 695 counties. Moderate is at 1,174 counties. Low is at 359 counties. Then we come over here to the varying proportion, which we know is wrong, and behind XBB 15, 87.9%, XBB 191, 4.6%, XBB 2.5%, XBB 151, 2.1%, BQ 1.1, 1.9%. Do I know when the CDC is going to add the XBB 116 variant? No, I don't. They like to hold off as long as possible. It'll probably come at some certain time, and it'll probably already be double-digit numbers nationwide, and people will be like, oh, the variant's suddenly here. Well, no, it didn't just suddenly appear. It's been here. The CDC's not adding it for some reason. For reasons we obviously do not know. Here we go. BNO News. New cases yesterday, 6,327. Average cases, 22,462. That's down by 454. States reporting, 7 out of 50. As you know, that's terrible, but as you know, it's because a lot of states only report once a week. Very few states report daily anymore. In hospital, 18,063 people. That's down by 639. In ICU, 2,548. New deaths, 100. The average deaths are 281. That is up by 3. And I suspect some of these weekly reportings, they may not even happen late this week. Going into the weekend, I don't expect to see anything from New York State, simply because it's Easter, it's Holy Week. They're going to take a holiday on reporting. They're just doing the bare minimum to report it as is. So any chance they get to not report, they're going to take it. Taking a look here at the hospitalizations in central Pennsylvania. This is Center County, the only hospital there. We're looking at it today because they did finally update today. Looks like the numbers have dropped ever so slightly, but I question if they have any bed space left. On last Wednesday's update, they had 0 beds available in Center County for adults. That new update will come in tomorrow with the Pennsylvania update. If I do get it, I will try and add that as well into the video. Taking a look here at New York State, 792 cases in the last 24 hours. Taking a look at the hospitalizations, they actually did rise. 1,009 people in the hospital, 107 in the ICU. On the previous update, it was 947 people in the hospital and 97 in the ICU. So, yeah, that did rise a little bit. Concerning, but to be expected on a Tuesday, but could signal the possibility of the start of a new wave. All right, we're not going to spend a lot of time with Walgreens today because it appears to me Walgreens really did not update today, but let's just get through a few states, shall we? First, nationally, 25% positivity. Previous week, 24.8%. That's up by a mere 0.2%, but hey, up is up. It's after being flat for a long time. Maine is still at 42.9%. They peaked at 45% back on Sunday. Prior week at this time was 20%. Then you come down here to Connecticut, and Connecticut's really starting to concern me. Connecticut's just rapidly going up now. 16.9% this week, 10.5% the previous week. That's a difference of up 6.4%. Mississippi, you're rapidly rising as well. I would like to think it's because of the new variant, but there's also the possibility with so many people being huddled together at shelters and different places, you know, people trying to help people out with the tornadoes, that could be leading to some cases as well. As sad as that sounds, or as crazy as that sounds, it could be leading to cases. But overall, probably the bigger reason is just a pure new variant coming in. So the combination there is leading to 26.8% positivity, up 9.4%. Prior week was 17.4%. Then we come over here to Montana. Montana is at 38.5%. Previous week at this time was 13.5%. That's a rise still of 24.9%. And let's zoom this chart in. It's still relatively going straight up. And we'll end on Wisconsin. 25% positivity this week in Wisconsin. The prior week was 24.8%. And yeah, that's up by 0.2%. And again, nationally, I should add, testing is down. We are going to have to watch to see what happens with the positivity nationally next week. Because as you know, in the north, or maybe some don't notice, in the northern states, all the high schools, elementary schools, middle school, a good majority of them, not all of them, but a good majority of them are on spring break this week. And they're on vacation with their families. So that could lead to a wave. And we know for a fact Easter's definitely going to contribute to at least some cases following this weekend. Here's Wisconsin. Yeah, Wisconsin hospitalizations. You can see here it was slowly going down. Might be trying to go up again. 369 people in hospital in Wisconsin. All right, quickly looking at some international data before we end this video. Let's refresh this, make sure it's up to date, maybe somewhere else. Updated since I last looked earlier. South Korea is now slightly dropping. Their deaths are up 12%. France, slightly dropping on cases by 9%. Deaths are up 29%. Then we come down here to Mexico. Cases are up 8%. Deaths are down 20%. Chile, cases are down 25%. Deaths have now dropped 100%, but now they're reporting 0 deaths. So what's that all about? India, cases are up 43%. Deaths are still up 21%. According to this, at least, maybe some sign of a slowing in India. Not really buying it. It's too early to say that yet. New Zealand's up 8%, and their deaths are actually down 64%, so that's some good news. Finally, we'll end on Romania. Their cases are down 15%, deaths are up 59%. Alright, that does it for today's pandemic update video. We will do another pandemic update video again tomorrow. We're going to keep doing these every day or as much as I can because things are getting bad again. Alright, until next time, stay safe everyone. Hit the like and subscribe button down below, especially if you're new to the channel. You'll get one of these videos again tomorrow. If you subscribe, you'll be notified about it. Alright, see you all again next time. But until I see you next time, please stay safe and do not test positive.